Good afternoon. Today is March 19th, 2020. I am Jason Rogers, the Delaware County Emergency Management Director. We are currently in the Emergency Operations Center with Delaware County Commissioner James King and Susan Morris, Nursing Director and Preparedness Coordinator with the Delaware County Health Department. Thank you for joining us today. Today's message is specifically for healthcare providers, both in facilities and at home. If you are caring for a family member or a loved one, today's information will be useful. We are working diligently with our local, state, and federal partners to flatten the curve. And today's message includes all of these partners.
I want to also especially mention aerosol generating procedures. These are very common in the pre-hospital care environment and would include activities such as a nebulizer treatment, positive pressure ventilation with a BVM, CPAP, BiPAP, even some procedures as simple as suctioning a patient can generate aerosols, which would put providers at greater risk. While doing these procedures, an N95 mask or higher level should be worn if at all possible. These procedures should be done prior to transport and outside an ambulance when possible. If these need to be done in an ambulance, the HVA system should be operational and the rear doors of the ambulance open when the ambulance is not moving. Again, aerosol generating procedures would include BVM, oropharyngeal suctioning, endotracheal intubation, nebulizer treatments, CPAP, BiPAP, or cardiopulmonary resuscitation. Please use the highest level of recommended PPE while doing those procedures. Having said that, protocols should be developed and implemented in coordination with your local medical director to limit these aerosol generating procedures when absolutely possible.
I'm State Health Commissioner Chris Box. It seems you hear about COVID-19 everywhere you turn, and I know that many of you are concerned about this public health threat. Together, we can protect ourselves. More importantly, we can protect each other with common sense steps. Please, remember to wash your hands with soap and water. Stay home if you're ill. Cover your nose and mouth when you cough or sneeze, and be mindful of neighbors, especially those older than 60 or who have underlying health concerns. Stay informed about COVID-19 at in.gov/coronavirus.
Hi, I'm Dr. Michael Kaufman, State EMS Medical Director with the Indiana Department of Homeland Security. As a result of the COVID-19 public health emergency, more than 2,700 blood drives have been canceled. This has resulted in a decrease of more than 86,000 units of blood being donated. Blood donation is safe, and there's currently a high need. COVID-19 cannot be transmitted through blood. We have a severe shortage. To find out where to donate, go to redcrossblood.org and enter your zip code, or call 1-800-RED-CROSS. All collection procedures have been adjusted for social distancing. Please help today.
Social distancing is when we all stay in, avoiding opportunities to be exposed or to expose other people to the virus. We should all avoid public places as much as possible to reduce the rapid spread of COVID-19 and keep ourselves and other people healthy. As more people are exposed to COVID-19, the number of people infected can spike dramatically. If everyone is sick at the same time, it could overwhelm hospitals. By avoiding public gatherings, we decrease the opportunity for the virus to spread from one person to many others. We can slow the spread and flatten the curve, ensuring medical resources are available to help those who need it most.
I'm Dr. Jennifer Sullivan, Secretary of the Indiana Family and Social Services Administration. Indiana's strategies for containing the coronavirus are causing changes to our daily lives that most of us could never imagine. As Hoosiers, we are responding to these changes remarkably. Meetings are now conference calls. Trips out to restaurants are becoming meals at home. And basement sofas and kitchen tables? Well, for many of you, those are now classrooms. Of course, all this is happening to protect the health of Hoosiers. In-person human interactions must be held to an absolute minimum. And in this extraordinary time, that must include contact between doctors, other healthcare professionals, and patients. That's why here at FSSA, we are making a change for our Medicaid patients to allow interactions between patients, doctors, and other healthcare providers to occur either over the phone or through the use of telemedicine whenever possible. This new policy will remain in place, and telemedicine, telephone interactions will be encouraged for as long as Indiana remains under a declaration of a public health emergency by Governor Eric Holcomb. We hope this will help Hoosiers get the care they need faster and more efficiently, while helping reserve our emergency rooms and hospital beds for sick patients who truly need a higher level of care during this public health emergency. There are some exceptions. You will need to be seen in person for things like surgery, radiology, laboratory services, and more. We encourage Medicaid members to call their healthcare providers and ask if your visit can take place by phone or through telehealth, especially if you have an appointment scheduled. Thank you for your time and for everything that you are doing to keep yourselves and your families safe. The more we do now, the sooner we can hopefully return to normal. Thank you.
I'm State Health Commissioner Chris Box. It seems you hear about COVID-19 everywhere you turn, and I know that many of you are concerned about this public health threat. Together, we can protect ourselves. More importantly, we can protect each other with common sense steps. Please, remember to wash your hands with soap and water. Stay home if you're ill. Cover your nose and mouth when you cough or sneeze, and be mindful of neighbors, especially those older than 60 or who have underlying health concerns. Stay informed about COVID-19 at in.gov/coronavirus.
As you can see, we are working diligently with our state and federal partners to flatten the curve. Thank you for taking the time to share our collective message today. We anticipate the next briefing will be tomorrow afternoon.